TB is a rod-shaped bacteria called Mycobacterium tuberculosis. Initially, this bacteria attacks a person's lungs but can eventually reach the spine, kidneys, or liver. TB is spread through the air when a person coughs, sneezes, or even speaks. Other people may breathe in the bacteria and become infected. A person may be infected with the bacteria but not show symptoms. This is called latent TB. Once the symptoms appear, it is called active TB. According to the World Health Organization, 1/3 of the world's population is infected with the TB bacteria. People with weakened immune systems, such as a person who is HIV positive, may become infected with the bacteria more easily than a healthy adult. A person with HIV is 26 to 31 times more likely to contract the disease. African males and females are more likely to have the disease. TB is spread quickly in confined areas such as prisons and nursing homes. The World Health Organization reports that TB occurs all over the world. It occurs most in Southeast Asia, Western Pacific region, Eastern Mediterranean region, and European region. However, Africa has the highest amount of cases. 2015 has the lowest number of TB cases reported worldwide since it was first documented. The death rate from 1990 to 2015 has decreased by 47%. In 2015, 9.6 million people had active TB. TB is ranked as one of the leading causes of death worldwide. Of these 9.6 million people, 1.5 million people died. 95% of these deaths occurred in low-income areas. HIV is the biggest risk factor for death for a person infected with TB. 1 in 3 deaths of people with HIV is due to having TB. The CDC reports that in the US, 3.2 per 100,000 people are infected with TB compared to 281 in Africa. There are fewer than 200,000 cases in the US per year. I have Stephanie Castro here with us. She's an experienced nurse in the Worcester County area. She has experience working with TB patients. How would you describe TB?
Well, TB is a bacteria that usually attack your lungs, but it can also be spread out to your body and can attack your spinal cord, kidney, and liver. Usually, it's transmitted by people through air, so coughing and sneezing can be one of the reasons why you can acquire TB.
In your work setting, who do you see affected with TB the most?
I would say people with HIV, they're the ones who have a weak immune system, so they usually get affected by this bacteria.
Okay. So do people die from TB?
Yes, we do see people dying for TB, but it's usually people who are HIV positive who acquire this disease, and they usually die from this.
So HIV positive people are more likely to die from TB?
Yeah, due to their weak immune system.
Okay. Statistically, how often do you see people with TB in your job?
I believe that the rates are trending down, especially in the United States. We don't see that many cases, but most of the people that we do see are people who come in from outside the country or who have traveled and come back to the USA. We see people that come in and they have those respiratory issues, and we usually rule them out, put them on airborne precautions, and wait until all the results and procedures come back negative.
Awesome, thank you.
You're welcome.